Good day. It's Thursday, April the 15th. I'm Martin Gago with Radius Research. Today we're joined by Andrew Morton, CEO of Maitri Health. That's MTEC on the CSE. Thanks, Andrew, for the overview with the PowerPoint. And now let's dig into some of the details. I guess with the on the software functionality, what are the types of features and okay, people check in, okay, I don't have a cough and fever and that sort of thing. But what kind of enterprise information do you see them sort of gathering or distributing or managing within an organization?
Great question. There's really three kind of key, and there's lots of use cases inside there, but there's three key use cases. The individual themselves is doing a self-check, and they're also signing off on certain things, confirming they're wearing, they're being safe. If they're supposed to wear a mask, they do. If they don't, they don't have to do that. But more than that, it kind of reminds them to be safe. It's almost like a psychological thing. Anybody can kind of fill these things in. And I think there's, unfortunately, 101 kind of very simple two-dimensional kind of COVID apps. It's not really an app. It's really a quick link. The user does their little thing in the morning, or in the afternoon, or whenever they show up on site, or if they're a guest, same kind of thing at the door, and in they go. Okay. So very simply that. What's really happening is they don't even get that invite unless one of the other use cases is a trigger first. Either somebody's vouched them and said, I'm inviting this person into the building, or the system automatically invites them because they've tested negative for COVID or some other kind of condition down the road. Imagine 5-6 years from now, maybe we have unfortunately COVID-23 or something else, who knows? The idea is that there's a triangulation. So they're not even really invited unless there's some kind of trigger for them to get in the building. That way we kind of keep the right people in and the wrong people out. You don't want to categorize people like that, but then there is that other use case for that. The third component for this is also the data component for the employer. And that other component is now you've got a log of everybody that's been in and why and the reasons associated with it. The great thing about having a complex database is you're able to kind of slice and dice data different ways and start figuring out what conditions led to this outbreak over here, or what's kept us safe? What are we doing right? Which is, sometimes when people always talk about the positive, but there's always something right. So that third case is the employer, or we'll call it the enterprise's view of what's coming and going. And there's also that triangulation of what the trigger is, just to invite that person to let them in to come into the work for the day. For the actual worker themselves, there's really not much to do. They wake up, they get a text, or they get an email invite. They log into a portal, they do their little attestation, we'll call it. They do their little list, and they come in. All they know is green means go, and that could just be a little check mark that pops up, whatever they like. From there, their journey there's no change for their journey. They just go in, they card in the security system like they always would, and we're actually pulling data every time somebody cards in or cards through a building. And the organization themselves, and that third component, maybe a second component, I should say, they now know that individual that confirm that they don't feel sick and they don't, they're wearing their mask, and maybe they took a little picture of themselves to prove it, that kind of stuff. They know that person's now safe wandering around, and they can now look at patterns to figure out where the safe and unsafe zones are. If you have people that refuse to wear a mask or refuse to get vaccinated or that kind of thing, well, then you start figuring out as an organization how you want to deal with that responsibly. We're not trying to track and trace individuals as much as help organizations figure out patterns. And when you start building those protocols in place, if there are some heavy protocols, like a great example is, I do know this for sure, some of the big auto factories treat anything you take off the shelf to do production with, like a welding tool or a wrench or that kind of thing. Those tend to be considered parts of production. Somebody checks it out and they check it back in. Well, why wouldn't masks be the same thing? You check it out and you confirm you're actually wearing something safe. So there's that link between the two. So the use cases really are those three key ones, which is user, employer, and then the third-party data that comes in.
And there's obviously for the health of the individual, and that if everybody gets sick on your floor in a department or so, then obviously that damages business. But then there's also, you mentioned it, the insurance side of it is they need insurance. They got to cover their butt to make sure, okay, we got sued, but look, we did all these protocols. We can't stop the virus, but we took due care and caution. Is that a key driver?
Without question, I think the biggest reasons for a company to want to do this is, cost. First of all, keep your business in business. The second one is costs. The cost of insurance is pretty incredible. I think that the big risk that companies are going to face in the next 5 to 10 years is going to be that if they're not covering, or they're not showing their safety protocols, their premiums are going to continue to rise. I was actually working in the U.S. when the Affordable Care Act came in. and we saw a jump in insurance premiums to an pretty incredible amount. I mean, I'm not political and I have no dog in this fight. I'm not too interested in talking about that. But what is important to note is that it was noticeable to the company that I was an executive in what our costs were for insurance. It was incredible. I really didn't have exposure to it until it kind of came up in a team meeting and in an exec meeting. And our CEO at the time said, "Well, all of us we're 20% more insurance premiums than we were before. We got to start making some hard choices around here." Well, the world adjusted to that, and that I think Affordable Care Act did the right things for the right reasons. That being said, now that we have this new thing where workplace safety is such a hot topic, especially given some of the class action lawsuits in the U.S. And the unfortunate criminal cases that are being filed here in Canada. Very recently, Cargill is actually very publicly there's a criminal case there's a petition for it for the RCMP to file criminal charges against Cargill in Alberta because a couple of folks died as a result of COVID transmission. Well, long term, what does that mean 5 years from now? So imagine COVID is behind us, and that's great. What if there's some other kind of healthcare situation? What if somebody's out spreading some other infectious disease? How do you avoid all that? And if you're an insurance underwriter, what kind of data do you need to keep from just going, well, you know what, I have no idea what's going to happen with you next. So now your liability premiums are now X instead of Y. And that's the big risk. So I think the ability to show some kind of reporting mechanism back to those insurance companies and say, here's why we're being safe. Here's what we're doing. Here's all the right things. I think that's what's needed here. And that's actually coming right from customer feedback.
Okay. This is a relatively new venture. Where are you in terms of your product, your software development and sort of client rollout and all that? So
we are currently developing the platform now. We're actually plotting out where our beta customers are in the coming months, which is pretty exciting. So it's all, this is not an overnight venture. We've been at this a little while. We recognized very early on in shipping PPE successfully to some customers what the bigger needs were for them. We saw that they were like, there's a much bigger thing happening here. We always saw ourselves as a tech business and always had a view of this. So we're now in that process. We're expecting some more announcements fairly soon on various features of the product. As a public company, I'll always announce these as they're 100% available because that's the most responsible thing to do. And we actually are plotting out what our beta customers are going to look like. So we're actually doing some of that. And the reasons why is as we complete development over the next couple of months, which is all real time, we want actual customers that want to buy this from us to give us feedback. Because then we're not only do they feel like we're tailoring it for their needs, but then we're not doing it in a vacuum. The big mistake companies often make in the software world is they kind of build the best mousetrap and then go to customers and say, okay, I have this for you. How many do you want to buy? That generally doesn't go well. And given that this is health and safety, this isn't like, some kind of office application, there's going to be some specific needs we may not even have thought of until we get through the field with this.
Yeah. And I can imagine, depending on laws and culture within organizations, that they'd want to do maybe track and trace or like, hey, who's met the infected person, or even any kind of just general security, who's walking around where in the building.
Well, without question, it's funny. The whole concept of this is to make it customizable, to make it really the rules based, depending on what the client wants. You're right. Because in some countries you can't collect certain amounts of data. It's funny you should mention track and trace. So, unfortunately in Canada, it's a great example. The take rates on the track and trace apps that are rolled out nationally were quite low, like in the 9% range. It was pretty light. And it's all publicly documented. And we took pretty hard notice of that, recognizing that, we don't want to be in the track and trace business per se, as much as the data business for organizations. And that's also why we focused also on private industry, because they have very different, very unique needs. They must stay in business, and within their four walls, as it were, where they've got a factory or an office or that kind of thing, those organizations have specific needs, so they can throttle on, full rules based. You must be vaccinated, you must be this, you must be that, or maybe it's lighter depending on who the organization is. But at the very least, they'll have data on the general condition if they just don't know, because for whatever reason, the local laws say we're in some country in Western Europe where GDPR and those kinds of things are really important. The human rights are a big deal. Well, then, and they can't insist on that. At the very least, they can know. They can also at the same time ask to make sure everybody's tested every day. Yeah. So it really depends case by case. But the key is you make it rules based for the organization to pick and choose. Well, then you have a happy customer. Yeah.
And do you see this initially rolling out in Canada or the U.S. or does it really matter? The border is kind of indifferent to you. The needs are the same.
Borders are different. The labor laws are different, of course, though, across the border. So that, hence the need to have a customizable platform.
Okay.
But I definitely will say the enterprise, customers in the U.S. are obviously much larger. It's just just surely by volume, by numbers. You just have some really big companies in the United States. But in Canada, there's some very obvious places. You got meat packing plants, telecoms, oil and gas. I mean, they all have to, at the energy industry. You can't run those places from a Zoom call. They have to get people back together to stay in business.
Yeah. And even though like office space is going to be downsized and so forth, when people do go back to the office, they want to, whatever, there'll be mandatory hand cleansing or whatever, and masks and in common spaces or whatever it is. So that's got to be all mandatory.
That's right. Well, I think I mentioned this earlier that, you've got what I like to call a binge diet, which is a lockdown. If anybody knows anybody that's been on a binge diet, I think we all know somebody that's done that. They go on the binge diet, 60 days later, they come off of it. They tend to gain all the weight back, and usually a few extra pounds while they're at it, right?
Yeah.
Because really that for whatever reason, that effect doesn't work. Unfortunately, we're seeing the same thing with lockdowns. I think we have to lean into all of this and create screening measures and ways to reduce transmission. And I think by creating protocols around this, I think that's the way to avoid this.
All right.
And the feedback we're getting from people, that are trying to figure out how to keep their companies open is the same. They kind of very quickly get the nods. And like I said earlier in my presentation, first time in my career where I didn't have to go out and identify a need somewhere, for an enterprise software package. It's obvious what the needs are. The elephant's already in the room. It's right there.
Switching over to the other, I guess, side of the business is the actual physical product, the PPE stuff. That is also, then you'll have local sort of Canadian manufacturing and then local US manufacturing. And that's going to be outsourced, but local outsourced. Is that the basic model on it?
That's right. I like to call it reshoring, there was actually a press release this morning. Actually, one of our board members is involved in a reshoring movement here in Canada. It was great to see, I like to think I inspired some of that press release. And I don't know, I hope I did. But there really is that reshoring. I mean, really, it's called onshoring is what I like to call it. That's right. Insourcing is kind of it's sort of another term you hear out there. Yes. So the short answer is yes. We want to be capital light. We are an integrator of premium materials. We really looked at best of breed for the right products. So, best masks. And I made that comment about the mask earlier, new hand sanitizers. It just seemed like there was an opportunity to offer a better product. Because, why not? Somebody made this crack to us about how, some of our products look almost like Apple computer-like, in the way they're kind of ergonomically funky and kind of neat. To me, the first thing I think of is because it's digitally connected, you actually know where it came from, because that's very Apple-like, right? Yeah. But realistically, they are just better to wear. And I think there was a need to do that. But because we do it onshore, we can control all of this.
Yeah.
Our suppliers are not, there's no mystery there, if that makes sense.
Well, yeah. And I think there's a general trend of sort of critical supply chain stuff, given like the Suez Canal and all sorts of things can happen. I think countries are realizing they have to keep at least a portion of critical infrastructure and supplies onshore, because you don't know what happens, and you realize when global supply chains work well, they're brilliant, but when they don't, not so brilliant.
Well, the scary thing about global logistics right now is that a container from the Far East is 3 to 4 times the price it was a year ago.
Yeah.
Just the container shipping. So something's definitely happened. Now, I don't know if it's because everybody's ordering stuff, nonstop from Amazon or something. I don't really know. I think maybe there's a combination of things. One of the things that's talked about a little bit within the logistics world is that there is a shortage of containers, and a lot of it has to do with the number of shutdowns at various ports around the world. Because remember, an empty container gets emptied, it's got to find its way back to wherever it's supposed to go.
Yeah.
And bluntly, and unfortunately, and this is something we'd like to see fixed here in North America, is that we don't ship a whole lot offshore.
Yeah.
So a lot of these containers are going back empty. So that's problematic to me. To me, I as I mentioned very briefly my background, I was involved in manufacturing. So, last couple of businesses, we were doing heavy manufacturing in mainland China. I personally was also involved in setting up a factory in Brazil at one time. And have a pretty good sense of how factories run and how to set up production and logistics and some of that. And, it's very difficult to explain to somebody from Canada or the US how it really operates offshore, just the sheer magnitude of production. The one village I went to, I remember this really well. They had 100,000 people in this town that we had a subcontractor in for manufacturing for some devices we were building there. This is good 10 years ago we did this. Within a year, there were 1 million people in the same village. 1 year. We can't, for us, that's significant because the offshoring happened so fast and so intensely. It was unbelievable. Shenzhen, which is a really cool place to visit one day. I hope to be able to go back to China. It's a fun place to go and visit. Food's great. It's an interesting place, a lot of history. Shenzhen went from like farmland to a, city with tens of millions of people in like 20 years.
Yeah. With like on the SaaS, your enterprise software side, that what typically has 80-90% margins, hopefully, if it's properly run. PPE side, I would think, has kind of probably that inverted, maybe that cost to profit ratio. Can you give us any sense on what kind of margins you expect to get on the PPE side of things?
Great question. If you were just selling masks and that kind of thing, and just kind of a maker of that kind of thing, I think it'd be quite low. In fact, I know it'd be quite low margin business, but because we're wrapping intelligence around it, making it a smart PPE where you can trace it to source and do some of that, that's worth a little more to a customer. So it makes it more like kind of a 20% kind of range, 20-25%. And you're right, inverted is about right, given your numbers. Yeah, that sounds about right, but not the low margin commodity business like it is, like it has been. And I think that's the difference here. Yeah. Part of why governments and healthcare providers are willing to pay more is because they've all had a bad experience in the last year.
Yeah.
There was, I dare say, dark money is a kind way of putting it. There were very questionable business practices over the last year. The UK government had to throw away $250 million worth of materials.
Yeah.
Canadian government, the number hasn't been reported, but I can only assume it's close to that. I can only assume this. Yeah. I think I mentioned tens of millions. I think it was 10 or 20 or 30 million masks or something if it was in the media in the last year. Some pretty heavy numbers. The US government is the same. I know of a number of stockpile warehouses in the US where there's just unusable material sitting there, which creates another big problem. What do we do with all this stuff? Yeah. And one of the things we've actually devised is a method to do recycling. Where for material you couldn't recycle. And what we're talking to many clients about now is a new concept where we trade in our masks for the stuff they can't use because it's not certified or fraudulent or whatever they've got. And we found a very safe way to dispose of it, emission-free, where some of the materials can be reused. And nothing hits a landfill, nothing hits garbage island out in the Pacific, nothing winds up in the face of some child in a different country, which would be a disaster. And for them, that healthcare provider, they're able to do the right thing and actually provide a safe product in return.
All right. So what does, let's say 2021 and 2022 look like for Maitri? What do you hope to get done in for the remainder of the year? And then as you hopefully gain some momentum for the following year?
So 2021, we'll see the announcement of some customers that are significant. Specifically in the software and PPE, but software specifically, I think the get back to work, or there's a term that we're hearing a lot of called RTO. Now, not the RTO that anybody financial thinks about. It's return to office. That's sort of the new acronym of the day. Yeah. And I didn't make this term up. A Fortune 100 client told me this, and we'll see some announcements around some return to office initiatives, or RTO. Yeah. We'll see a launch of our software platform, and we'll see some early customers. 2022 definitely will. The way I'd envision this is that we'll suddenly become that standard, or not so suddenly, of healthcare safety within the workplace. I see us being that chief medical officer as a service, and as a SaaS business, there's some really good reasons why they'd want to keep us. And one of them is that they themselves can start to bring protocols in without them having to do the hard, heavy lifting. We can say, look, here's the opportunity to generate reports, have protocols in place, keep the workplace safe, and have a really good picture of where things sit. I think once we get through vaccinations, the unfortunate thing is we're going to have to deal with things like boosters every year. So how do you track who's getting boosters and who isn't? Pfizer's already announced that their booster for the Brazilian variant is sometime at the end of this year. So there's one booster. We're probably going to see for immunity boosters on an annual basis. And I don't think testing is really going to go away. It's just going to change a little bit. I think we'll see testing as it sits for the next 2 to 3, 4 years, probably. But beyond that, immunity testing is going to be part of the program. And I see us getting involved in that really kind of into later this year and into next year as boosters start to happen.
All right. Okay. I'm kind of running out of questions here. I'm not sure what else to ask. Is there any other points you want to highlight or things that we should discuss before we wrap things up?
Well, I think it's important to note that there's been a lot of talk about return to office. Some pretty large companies have made a lot of noise about this. I think what differentiates what our focus is we're quite agile. We have a very focused team. This is what we do. And I will say it's playing quite well, and the message definitely resonates with the right clients. When we started this journey at Maitri, we certainly didn't do this to chase an ambulance and get a quick buck and all of that. We recognized there was a bigger thing happening, and all this really came from what was exposed over the last 12 months as a system in need of a little help. And there was never, things were just fine. Things worked. You went to the doctor. Nothing's perfect, but things work. But unfortunately, this also identified something else. We were clued into by one of our advisors, is that within the healthcare community, they always knew that there were some little issues there. The supply chain was problematic, and everybody just kind of hoped that would never really expose itself as being a bigger deal. They just go to hobble through. And then the other side of it is, what happens if we had a mass outbreak of some kind? Now, as a frequent flyer, I saw airports get busier and busier and busier, and you knew you were getting closer to critical mass somewhere.
Yeah.
All we're doing now is addressing what really any problem in the future. So now, 5-10 years from now, there is a new protocol, and that 9/11 style event, the way we go to work, the way we travel, the way we do all these things changes. In really our sector of the market, which is workplace safety, we can make those places safe again.
All right. Well, that seems like a good idea. Make it safe, because a lot of people are, my wife's a teacher. Just if there would be better protocols and understanding within the school system, that would sure reduce her level of stress there.
Certainly.
All right. Thank you very much for taking the time to chat. That's really good. All the best, and let's get you back sometime in the future and get an update on how things are progressing.
My pleasure. Thank you for having me.
All right. Thanks a lot.